Good afternoon, everybody. My name is Ashish Shah, and I am the COVID-19 response coordinator for the White House. First of all, apologies for the technical delays getting us started, but I am excited and delighted to get going this afternoon with two familiar faces, two colleagues who have been tirelessly battling the pandemic since the beginning of this pandemic more than 2 years ago. You know them both well, Dr. Rochelle Walensky and Tony Fauci. Today, we want to update you on a really important topic, one that many parents and really America has waited for a long time. The first COVID-19 vaccines for our youngest kids. You know, it's been nearly 18 months since the first set of vaccines became available for adults. And just over the last week, we saw the FDA authorize and CDC recommend vaccines for children 6 months and above for the first time. Now, this is an important moment for families of kids under 5. But it's a historic moment for our nation because essentially every American, from our oldest to our youngest, is now eligible for the protection that vaccines provide. Now, we know that these vaccines are extraordinarily safe and highly effective. Remember, after an extensive review by career FDA and CDC scientists, they were unanimously approved by an independent group of expert scientists. Now, I like to remind people, it's hard to get a group of independent scientists to agree on anything. And yet, 21 independent scientists who serve on VRBPAC unanimously voted in agreement that the benefits of these vaccines clearly outweigh the risk. And then 12 independent scientists that make up the ACIP agreed, recommending these vaccines for kids 6 months and above. Now, we have been at HHS and in the administration have been planning and preparing for this moment for a long time. When the president took office, he made a commitment to keep all families safe from COVID-19 across America. The availability of these vaccines brings us that much closer to that goal. Now, to make sure that these vaccines get to the families that want them, we have launched a comprehensive effort with trusted partners. These partners include states, local health departments, pediatricians, family physicians, rural and community health centers, and pharmacies. In fact, our largest federal pharmacy partners, Walgreens, CVS, and Walmart, are stepping up and already vaccinating children, as are many pediatricians across the country. Now, as I have said to all of you on many occasions, we know this vaccination program will ramp up over time. Remember, vaccines could not be shipped until they were authorized by the FDA on Friday. As of today, I can report that more than 4 million doses have been delivered within days of authorization to approximately 13,000 sites across the country. And as more doses are received and more sites make those doses available, that information will also become available on vaccines.gov. Now, when you look at this vaccination program for our littlest Americans, it will feel a little different than the vaccination programs we've run before. And that's because we know parents will be turning to their pediatricians and their family physicians. We have been guided in our approach by very clear data that says that most parents want to vaccinate their littlest ones in familiar settings. We also know that many parents have questions. And we want to encourage every parent to talk to their physician, to talk to the pediatrician, to talk to the family physician. We also know that confidence in vaccines builds over time. And I remind people that at the start of the adult vaccination program back in December of 2020, only 1 in 3 adults said they were eager to get the shot. Today, nearly 90% of adults have gotten at least 1 shot. We know the importance of working with trusted voices and community leaders, and we're doing just that. HHS has partnered with over 1,000 organizations, many of which work in minority and rural communities. Organizations like the National Parent-Teacher Association and the Cobb Institute of the National Medical Association. Both of them have been great partners. We've also started the COVID-19 Community Corps, an effort that has grown to include 17,000 members across healthcare, sports, rural, and faith organizations. Organizations like Black Doctors for the COVID-19 Consortium and the National Indian Health Board. Now, I want to address one issue that's very important, and that is the issue of misinformation about vaccines and about kids and COVID in this pandemic. So let's set the record straight, because the data here is actually quite clear. Kids are better protected if they are vaccinated. If they are vaccinated, they are far less likely to get seriously ill. They're far less likely to end up in the hospital, far less likely to end up in the ICU. Tens of millions of children in the US and around the world have already been vaccinated against COVID. And the safety profile of these vaccines is extraordinary. I have 3 children, all of whom have been vaccinated. In fact, every physician I know, including and particularly pediatricians, have all vaccinated their eligible children. And we've come a long way in our fight against COVID-19 with vaccines and treatments and other tools like testing that have become widely available. And I'm pleased to make another announcement today. The Biden-Harris administration is making more accessible tests available for individuals who are blind or visually impaired. These tests are available for free through covidtest.gov. We developed this plan in close partnership with members of the disability community. An issue raised consistently was that individuals who are blind or low vision are often unable to utilize rapid self-tests on their own. The president has made clear he is committed to addressing the needs of individuals with disabilities, regardless of where they live or the level of community transmission. Ensuring everyone has equitable access to COVID-19 testing and all other critical mitigation strategies is of the utmost importance. So in closing, the numbers in our fight against COVID-19 speak for themselves. Nearly 3 months after cases began to rise in the US, the deaths are actually down, and down 90% since the day the president took office. Why? This has not happened randomly. Deaths are down because 2 out of 3 Americans are fully vaccinated, and half of them are boosted, because we have widespread availability of therapeutics like Paxlovid. So yes, we've made a lot of progress, but our job is not done. The pandemic is not over. And while we still have a lot of work to do, it is worth celebrating milestones. And this week, as the littlest members of our society begin to get vaccinated, we need to take a moment and reflect on the good news that is. All right, with that, I'm going to turn it over to Dr. Rochelle Walensky, who will update us on the state of the pandemic and the importance of getting vaccinated, getting children vaccinated. Over to you, Rochelle.
Thank you, Ashish. Good afternoon, everyone. As per my usual, I'd like to start by walking through the latest data. So our current 7-day daily average of cases is about 99,400, and that represents a decrease of about 4% over the prior week. The 7-day average of hospital admissions is about 4,400 cases per day, which is an increase of about 2% over the prior week. And as Dr. John noted, the 7-day average of daily deaths is about 250 per day, which is a decrease of about 16% over the prior week. CDC does follow COVID-19 community levels, and that allows individuals and communities to take action to protect themselves and others based on their local community level. This also allows us to focus our efforts on protecting those who are most at risk of severe COVID-19 illness. Last week, CDC reported 21% of the US population was living in a high COVID-19 community level, and nearly 40% was living in a medium community level, and 39% was living in a low community level. We will have updated COVID-19 community levels posted tonight, and we do anticipate things shifting among our communities across the country. So please go to cdc.gov, where you can find your COVID-19 community level online. As Dr. John noted, this past week, we've taken another important step forward in our fight against COVID-19. Following rigorous scientific review and a transparent and comprehensive discussion by ACIP on the immune response, safety, and ability of vaccines to protect children against disease, CDC expanded its COVID-19 vaccine recommendations to all children 6 months through 5 years of age. This makes nearly 20 million additional children eligible for vaccines. I know there's been a great deal of anticipation for parents surrounding the authorization and recommendation of COVID-19 vaccines for our youngest children, and for many, the opportunity to vaccinate their children comes as a welcome relief. For those who may still be hesitant, I want to emphasize that COVID-19 vaccines have and continue to undergo the most intense safety monitoring in our history. Parents, it is of course okay if you still have questions, and if you do, I encourage you you to talk to your child's provider, your local pharmacist, to learn more about the benefits and, of course, the safety of these vaccines. In the meantime, I'd like to outline why COVID-19 vaccinations for our children are particularly important. We do know that COVID-19 illness can be serious for children, and that as parents, we are always looking to do what's right to protect them against harm. While we want to prevent severe outcomes for every age, it's especially concerning to see severe outcomes in our youngest children, the hospitalizations and deaths. Children should not need to be hospitalized. They should not need to go to the ICU to be on a ventilator, and they certainly should not lose their life to this virus at such a young age. During the Omicron wave, we saw a huge spike in COVID-19 cases in children and the highest hospitalization rates in children than at any other point during this pandemic, especially among our youngest, ages 6 months through 4 years, who had the highest rate of hospitalization among any age group under the age of 17. Since January 2020, we've lost 215 children aged 6 months to 4 years to COVID-19. To put that in perspective, during March 2020 through April 2022, COVID-19 was among the top 5 leading causes of death in every age group of children under the age of 19, and the #1 infectious cause of death in children. No parent should have to face the stress of having a child who's severely ill. Protection gained from COVID-19 vaccination could be the difference between a hospitalization, a hospital visit, or even saving a child's life. And that's unequivocally great news for parents. We all want to do what's best for our children, and for the safest vaccine and protection against COVID-19, do go and get your child COVID-19 vaccinated. Young children do not need to have an underlying condition to be at risk of severe disease. In fact, over half of children hospitalized with COVID-19 were otherwise healthy and had no underlying medical condition. And children who've previously had COVID-19 can also still benefit from a COVID-19 vaccine. Evidence has shown that vaccine immunity results in a broader neutralizing antibody response, that is broader protection against variants compared with infection-induced immunity alone. So as a parent, as a physician, and as your CDC director, I strongly encourage all parents to get their child vaccinated. Our fight against COVID-19 is not over, as Dr. Jean mentioned, but we are in a much better place, and we are now armed with vaccines for our very youngest. And we have the armamentarium in our toolbox to face this virus head on. Thank you. I'll now turn things over to Dr. Fauci.
Thank you very much, Dr. Walensky. What I'd like to do over the next minute or two is to just underscore and answer preemptively some of the questions that Dr. Walensky and Dr. Jar and I have received over the last few days since the announcement was made. Let's just take a very quick review of the questions that people ask. For example, parents ask, how did they come to this conclusion? What was the data that led to the approval and recommendation of these drugs? Well, as you know, of these vaccines, as you know, we have 2 in question, Moderna and Pfizer. Both of those have gone under extensive placebo-blinded control trials, which is the gold standard of determining efficacy and safety. If we go first to the Moderna trial, it involves 6,400 children and infants. The important point to emphasize is that this is a vaccine which is 2 doses 4 weeks apart. Importantly, the immune responses that were elicited by the vaccines were comparable to those responses in younger adults and in adults that were receiving a higher dose that unequivocally in a clinical trial led to a clinical benefit. So even though this is mostly an immunological bridging study, the fact remains that it is highly correlated with a good clinical effect. What about the safety of the Moderna? When you do vaccines, one of the things you address is what's called reactogenicity, namely what's the immediate local or systemic effect. So in summary, and very briefly, the reactogenicity of this vaccine was essentially the same, no better or worse than what we've seen with any of a number of childhood vaccines that we regularly administer to our children. There was no incidence of myocarditis or multi-system inflammatory syndrome of children. Very quickly, moving on to the Pfizer, which was a bit different. It was in 3 doses. First dose is separated by 3 weeks, second dose by 8 weeks. Again, the bridging immunological situation indicated that the responses that were elicited by this vaccine was equivalent to the responses in other studies, including young adults and in adults, which were clearly associated with a beneficial clinical response. With regard to the safety data of Pfizer-BioNTech, the same thing. The reactogenicity, for example, fevers, pain at the site, were really quite comparable to what we've seen in vaccines that all of us have been administering to our children over years and years. The bottom line of all of this is that the FDA evaluation and analysis of the safety, effectiveness, and manufacturing data were very rigorously and comprehensively looked at to support the EUA. The known and potential benefits clearly outweigh the known and potential risks in this pediatric population. And we want to make sure you understand, parents, that prior to making the decision to authorize and recommend these vaccines, the FDA's and CDC's independent advisory committees, as you heard, were consulted and voted unanimously in support of the authorization and the recommendation. Therefore, we are all very enthusiastic about getting your children vaccinated with these now available products. Back to you, Dr. Jha.
Great. Thank you, Drs. Fauci and Walensky. Let's go ahead and go to questions, and I'm going to ask my colleague Kevin Munoz to get us going on that. Kevin.
Thanks, Dr. Jha. I say this a lot, but we have to keep one question per person, so please do that so we can get through as many as we can. Cheryl Stolberg, New York Times.
Hi, thanks for doing this call. I'm going to immediately violate your admonition and ask 2 questions. First is about the kids' vaccines. I noticed on the vaccines.gov that a lot of these pharmacies say they'll vaccinate ages 3 and up. And I wondered why that is and if there's a problem with getting vaccines to the youngest